I started off working in general practice. I was a nurse practitioner, prescriber, and I loved my job, but I was a bit bored.
I'd never had a vocation to work in prisons. I worked in hospital for a long time and I dabbled a bit in retail pharmacy. And then the job came up and I thought I'd do it for 5 years. 12 years later, I'm still here. I love it.
I can't imagine doing anything different. I cannot imagine working outside of offender care. You speak to people and they'll all say the same thing. No 2 days are the same.
The first time I went into a prison, I can remember being scared and then speaking to an individual, and it was only as he walked away that I thought, he was a prisoner. And I don't know what I'd expected, but I hadn't expected it to feel so normal.
There's an idea on working in a prison that is false because you only ever hear the bad things about prison. And when you come in here, you see all the good that's happened and all the good that can come out of it, but that's never talked about.
I think some very simple worries that can be eradicated really easily around safety and risk, thinking that it's a very violent place to work. Of course violence happens, but it's managed safely, and nurses are looked after.
I would say there's nothing to worry about working in a prison. I worked 15 years in A&E and I've felt safer working in a prison than I ever felt working in an A&E department.
We have panic alarms, whistles, there's emergency alarms everywhere. Officers are very aware.
Other anxieties healthcare professionals may have is that nurses and doctors that are in a prison don't get opportunity and access training or continual professional development, and that's just not true either.
Since I've been here, I just think I have more opportunity than if I was actually in a hospital setting. I've been on different training courses. If I was in the hospital, there's always a queue. You end up spending 5-10 years and never even get a mentorship training. And like here, there's always a course for you to go on.
We should have video clip that actually shows you actually how to do it.
Working in a prison environment is, I think, a very fascinating, interesting place. It has lots of complexities and some challenges.
Especially for students, it is a fantastic experience to come to because you will not get the same situations outside of here in the community, and you won't get them in such a controlled and safe environment.
It's also a real privilege, I think, to be able to work with people who have often been very isolated from society.
That is one thing that keeps me going, keeps me in the job if I'm making a change. Because some of the people have actually given up. Some of the people have got no families, some of the people, they've faced difficult times in their lives. So you actually encourage them and give them options, and then they get help and support.
It's the rehabilitation process for me, seeing the patients come into the establishment and actually seeing their progression to when they leave.
You know, you look at the ID cards when they come in and when they are leaving, it's a huge difference.
The most rewarding part, I think, is feeling that you've done something for the patients. A lot of our patients are very young. They just need someone to talk to.
Each of the people that live here, whether they are well or whether they're unwell, whether they're suffering with mental health condition, they are people in somebody's family, and the more that we can look at them like that and understand that enables us to care for them better.
To me, it doesn't matter where you work, all the patients all need care.
I looked after a gentleman. He became poorly and we did have to take him to the hospital. He died and I was with him when he died. The fact that we were able to give him a dignified and supported death, I think that's a really positive thing to be able to do.
A couple of years ago, I had a young lad come in. He was only 18. He was really upset. I sat with him for quite a long time chatting to him, and then every day I made sure I went to see him, so I was able to get to know him really well. He left early this year and he came and said thank you to me. Said I made him change his life, and he said he would never come back in prison.
I would say it's the best job I've ever had, and I've been a pharmacy technician for 20 years.
The fulfillment you get from this job, it just makes you feel like good that you can make a difference.
Coming here was a big change, but it's one that I don't regret. I absolutely love my job.